Well, good afternoon. Thanks everybody for coming. For the last several weeks, my staff and I have been monitoring the rise in COVID-19 cases caused by gatherings during the winter holidays and from the new Omicron variant. We've also been in regular communication with healthcare leaders across the state. They are all saying the same thing. The continued spread of COVID-19 throughout Kansas and the potential for further spread in the days and weeks ahead is part of the toughest surge the medical community has faced since the pandemic began in 2020. Most concerning is the body of evidence across the world showing that the Omicron variant is more transmissible than the Delta variant. Even among those who are vaccinated and have received their third or their booster shot. That means even though most of our frontline healthcare workers have received their vaccines, many of them are having to quarantine with breakthrough cases. These quarantines are creating additional staffing shortages in hospitals and nursing homes, many of which are already understaffed and overburdened. The surge threatens local healthcare systems with an overload of hospital beds, personal protective equipment, testing and treatment supplies, and other critical resources for responding to the COVID-19 pandemic. I say all of this because we must be candid, we must be clear-eyed and honest about the threats we are facing. That's why today I issued a 15-day state of disaster emergency declaration and 2 targeted executive orders. The executive orders mirror actions I took early on in the pandemic and will immediately help alleviate the strain felt in our hospitals and in our nursing homes. Again, the new orders are narrowly tailored for our hospitals and long-term care facilities with the they'll be providing the hospitals and long-term care facilities with the necessary staffing flexibility to keep residents, patients, and staff safe. We will not be issuing any sweeping mandates or closures. Instead, we're creating flexibility to allow routine care to be provided by alternative staff so that the more complex and serious cases can be handled by clinical staff. For example, Executive Order 2201 allows physician assistants and advanced practice nurses to order the collection of throat swabs for COVID-19 testing, which relaxes the need for a physician's order to do the testing. It allows nursing staff with exempt, inactive, or lapsed licenses to provide medical services appropriate to their education, training, and experience, which would directly increase the staff available for patient care. It also allows students enrolled in programs to become healthcare professionals and emergency medical personnel serving in the military to volunteer at healthcare facilities as staff augmentation, and healthcare professionals licensed in other jurisdictions to practice in Kansas. Executive Order 2202 allows for similar flexibility within our nursing homes. Temporary aides, after receiving training, will be able to provide some direct care staff duties for residents at the bedside that will free up certified staff and nurses to focus on providing higher levels of care. The order will also assist facilities with staffing flexibilities needed to quickly establish isolation units to quarantine residents to minimize or control an outbreak. The disaster declaration will keep these orders in place for 15 days as a stopgap until the legislature can convene and send me a bill. My staff and I have been in communication with legislative leaders, both about hospital capacity and our proposals to address that problem. I look forward to working with the leadership to create and fast-track legislation to codify these orders into law through the end of March. Our hospitals have sounded the alarm about the impact this surge is having on their facilities, their staff, and their patients. This is our opportunity to help them. Kansas has come so far in the last 2 years. We have tools, knowledge, and data that have completely changed our strategy in fighting this virus. Numbers right now are bad, but there is reason for optimism. Just as the evidence is clear that Omicron is more transmissible, it is also clear that Omicron's symptoms are much milder than Delta. As Omicron becomes the dominant strain, it will mean more COVID-19 infections, but over time, a significant reduction in hospitalizations and deaths. But no one should interpret that point as a reason not to get vaccinated. We have a year's worth of evidence that the vaccines, taken now by millions of Americans, are safe and will prevent most severe cases, hospitalizations, and deaths. And in the short term, every person who gets vaccinated or gets a third shot is helping our hospitals and our frontline healthcare workers. They are helping ensure that patients seeking care in hospitals for non-COVID illnesses and injuries will be able to get the attention they need. They are helping their immunocompromised and high-risk family and friends. I urge all of my fellow Kansans to help each other and help our frontline workers by getting vaccinated and getting that third shot. And with that, I'll take some questions.
Governor, are you concerned that the quality of treatment of COVID patients may deteriorate without those higher level medical personnel?
You know, right now we have an issue because of a staffing shortage. So is it ideal? No, but it is better than what's currently going on where people are not getting treated. We know that we have patients who need to be transferred from one hospital to a higher level. Hospital can't be transferred because we don't have the staff. We have got to use whatever tools at our disposal to alleviate that shortage.
Will you allow I believe that the Finance Council or the LCC to extend your emergency orders? Or do you want them to come up with the legislation to come up with a bill, like you said earlier?
I think it would be easier to just have the legislature come up with and fast track a bill through, get it done.
Are you anticipating National Guard personnel being deployed to hospitals as part of this emergency order?
No, we do not anticipate that. You know, as I think our Adjutant General has said before, you know, we don't really have a lot of medical personnel within the National Guard who aren't currently providing medical care in some of our community hospitals. So it would just be a matter of shifting them from one setting to another and would not add significantly to our workforce. That's one of the reasons that we are offering these executive orders today, or issuing these executive orders today, is because we don't have those kinds of resources available to us through the Guard.
Governor, could you do these executive orders without the emergency declaration?
No.
And I wanted to get back to your point that you're not doing broad things, closing schools, all that. Under the laws as they were revised, you can't, can you?
Even if I could, that's not the intent. I mean, I think we're responding to what we know is an urgent and immediate need. You know, I'm sure most of you saw the press conference yesterday with a variety and a multitude of our healthcare professionals from all across the state. This is an emergency. It's important, and that's why we're issuing these emergency executive directives.
Did that press conference spur this action?
No, actually, we've been having conversations with our hospitals. We've been in conversation with them for several weeks. We knew that it was very likely that we were going to have to do this. The timing of it is coincidental.
Governor, why are you taking this action now and not 2 weeks ago or during the Delta surge?
Well, we didn't really know at that point how this Omicron was going to impact our hospitals in particular. You know, once we figured that out, we got it together and we're doing it now. So we can address that issue.
The legislation that you want, do you just simply want to codify the 2 executive orders? Is that what you're
Yeah, that's all we need is a very simple bill to codify the executive orders take those and extend them, you know, past the 15 days, because when the emergency declaration expires, without that bill to extend the executive orders to March, the end of March, then they would go away. And we've, in consultation with our hospital leaders, we're confident that by extending it to the end of March will get us through this surge, and they won't have the need for these executive orders at that point. Could be before that, but definitely by then.
Are there further efforts or programs you could use if the legislature hadn't so reduced your authority?
You know, not at this point, Martin. You know, what we have clearly is a shortage of medical personnel, and so we're sort of reissuing this executive order. If you remember, these are not new. We did this early on, and so now we're responding to the workforce shortage the same way we did at the beginning, by just issuing these executive orders so that people who have skill sets but might need to practice a little bit out of their traditional scope will be allowed to practice outside their additional scope, freeing up the highly skilled medical personnel to deal with more critical and complex issues.
Governor, with this new order, would hospitals or nursing homes be eligible for maybe federal aid, state aid? If so, how much are you thinking?
This really doesn't have anything to do with the funding for those folks. It would just give those nursing homes in particular. If you can remember early on in the pandemic, you know, when there was the outbreak, you know, we had issues of trying to quarantine patients, and we needed to have some flexibility of where you could put patients and which staff could go where. That's what this does, is reinserts that ability to do that, but it didn't have anything to do with funding.
Is this going to make any real measurable difference? The hospitals are still going to be stressed out. There's still going to be a worker shortage.
Oh, there's no doubt, you know, that this won't solve all the problems we've got in our hospitals, in our nursing homes, but you know, it did succeed the first time around when we did this. It really did help them, you know, provide the staffing they needed to ensure that residents were safe.
How important is it to do it today? What are you hearing personally on hospital floors to get this done and make staffing flexible?
I'm sorry, I couldn't.
How important is it to do it today to make sure that this staffing is flexible?
Well, it's very, very important. You know, that's what we heard from our hospital leaders, is that we needed to do this, and we needed to do it as soon as we possibly could to alleviate the shortage.
Governor, have you talked with other state governors? Are the states that are joining us, are they also having this type of problem?
Yeah, I think hospitals across the country, you know, if you look at the maps now of the hot spots, you know, it's almost the entire United States. So yeah, every state is facing these issues, and you know, and this is on top of the other shortages that we have. You know, just, you know, because of the use of visiting nurses and the competition for those folks. So every state's going through it, and I'm sure a lot of them are taking these same kind of steps to solve the problem.
Given what we're seeing with the numbers of COVID cases and Omicron, does that cause you to rethink your support in signing that bill that makes it easier for workers to evade vaccine mandates?
No, I'm really not thinking about that as I was putting these executive orders together.
Thank you.
Governor?